Welcome to NSG 229, Study Session 8, Exclusive Breastfeeding, EBF. Introduction. You sometimes determine the quantity of food and the type of food you want. In doing this, you reflect your choice. So does the human body naturally prepare for the coming of a baby by preparing the mother with the necessary and essential diet that will help the child to grow. In this study session, you will learn about exclusive breastfeeding, milk production management, technique and positioning, factors affecting exclusivity and duration of breastfeeding, diet during breastfeeding, WHO breastfeeding guideline for HIV-infected mothers. Learning outcomes. At the end of the study session, you should be able to 1. Define exclusive breastfeeding. 2. Discuss the production of milk and management of breastfeeding. 3. Discuss the factors affecting breastfeeding. Definition of exclusive breastfeeding, EBF. Exclusive breastfeeding is the practice whereby the infants receive only breast milk with no supplementation of water, other liquids, tea, herbal preparations, or food during the first 6 months, with the exception of vitamins, minerals, supplements, or medicines. Exclusive breastfeeding means that the infant receives only breast milk. No other liquids or solids are given, not even water, with the exception of oral rehydration solution, or drops, or syrups, or vitamins, minerals, or medicines. According to the WHO recommendations, the appropriate age at which solids should be introduced is around 6 months, due to the immaturity of the gastrointestinal tract and renal system, as well as the neurophysiologic status of the infant. Breastfeeding is the feeding of an infant with breast milk directly from the breast through lactation rather than using bottle. Breast milk is the milk produced by the breast of human. Milk is the primary source of nutrition for newborns before they are able to eat and digest other foods. Adequate nutrition during infancy and early childhood is essential to ensure growth, health, and development of children to their full potential. WHO recommends that infants should be breastfed within 1 hour of birth, and that infants should be exclusively breastfed for the first 6 months. Advantages of breastfeeding. It helps the mother and baby form a close bond, comfort, and emotional support and security. It is much cheaper than formula feeding. It contains a variety of anti-infective factors such as white blood cell, antibodies, and bifidus factors, which help the baby combat diarrhea and respiratory infections. The contents of the milk are ideally suited for the baby's nutritional need and are easily digested. Continuous breastfeeding delays material ovulation, gives the mother a sense of achievement and satisfaction. Composition of human breast milk. Vitamins ADEC and BC. The exact composition of breast milk varies from day to day, depending on food consumption and environment, meaning that the ratio of water to fat fluctuates. Colostrum versus breast milk. During the first few days after delivery, the mother produces colostrum. This is a thin yellowish fluid. It is rich in protein and antibodies that provide passive immunity to the baby. The baby's immune system is not fully developed at birth. Colostrum also helps the newborn's digestive system to grow and function properly. Colostrum will gradually change to become mature milk. In first 3 to 4 days, it will appear thin and watery and will taste very sweet. Later, the milk will be thicker and creamier. Human milk quenches the baby's thirst and hunger and provides the proteins, sugar, minerals, and antibodies that the baby needs. Breast milk production. When the baby sucks its mother's breast, a hormone called oxytocin compels the milk to flow from the alveoli through the ducts, which coats the gastrointestinal tract, milk canals, into the sacs, milk pools, behind the areola, and then into the baby's mouth. Under the influence of the hormones prolactin and oxytocin, women produce milk after childbirth to feed the baby. The initial milk produced is referred to as colostrum, which is high in the immunoglobulin IgA, which coats the gastrointestinal tract. This helps to protect the newborn until its own immune system is functioning properly and creates a mild laxative effect, expelling meconium and helping to prevent the build-up of bilirubin, a contributory factor in jaundice. The amount of milk produced depends on how often the mother is nursing and/or pumping. The more the mother nurses her baby or pumps, the more milk is produced. It is very helpful to nurse on demand rather than on schedule. Management of lactation. Prenatal period. Successful breastfeeding depends on early preparation during pregnancy with teaching. The mother should be informed about the benefits of breastfeeding and the problems that may be encountered during breastfeeding. Prenatal classes with other women are particularly useful. Technique of breastfeeding. 1. Mother sitting with upright and flat lap. 2. The baby's body turned towards the mother's body. 3. The baby's mouth opposite the nipple, neck slightly extended. Positioning and attachment of the baby to the breast. It is important for an infant to be properly positioned and attached in order to avoid injury to the nipple and to promote successful breastfeeding. The mother should be comfortably seated and relaxed. The baby should be held so that the head and body are in a straight line, held close to the breast. The whole breast should be offered to the baby. The nipple and areola should not be pinched with the fingers and should not be pushed into the baby's mouth. The baby should not just be chewing on the nipple. The baby should be relaxed, taking slow deep sucks and swallowing without difficulty. The mother should not feel any pain. Factors that affect exclusivity and duration of breastfeeding. 1. Insufficient milk supply. Almost all well-nourished women can produce enough milk for their children. A malnourished woman may not be able to meet the requirements of her child, but in most cases, the problem of not enough milk is due to an incorrect perception that the child is feeding too frequently. Breast milk feed is quickly absorbed so that a child will want to feed every 2 to 3 hours. So, that may mean that the child is not getting enough milk. Depending on the examination, management will include improving the mother's diet, encouraging her to breastfeed more frequently, and discouraging her from giving artificial feed to top up her breastfeeding. If the child is not growing, underlying illnesses should be ruled out. As well, investigate the problem of the mother's milk supply. 2. Engorgement. This is usually the result of infrequent feeding in a woman who is producing a lot of milk. The baby should be put to the breast soon after birth and allowed to breastfeed without restriction. Treatment of engorgement requires teaching the mother how to express some of the milk. Warming of the breast with warm, soaked towels may help the milk to flow. 3. Blocked ducts. A tender swelling in one segment of the breast indicates that milk is not being released from that lobe. The mother should feed the baby frequently. The side with the swelling should be massaged towards the nipple. 4. Mastitis. If engorgement continues for a few days, that area may become infected. If untreated, it may lead to an abscess. The breast milk should be expressed and antibiotics given. Mastitis is not a contraindication to breastfeeding. 5. Sore nipples. Cracked. Some nipples are usually the result of a poor suckling position. The baby should not be allowed to suck only on the nipple. The management is avoidance and education. Allow the nipple to dry by exposing it to air. Traditionally, int milk is left on the nipple to help it to heal. 6. Societal barriers such as employment and length of maternity leave. 7. Inadequate breastfeeding knowledge. 8. Lack of familial and societal support care. 9. Lack of guidance and encouragement from health professionals. Diet during breastfeeding. Women who are breastfeeding need to be careful about what they eat and drink, since things can be passed to the baby through the breast milk. Just like during pregnancy, breastfeeding women should avoid fish that are high in mercury and limit lower mercury fish intake. If a woman ingests alcohol, a small amount can be passed to the baby through breast milk. Alcohol containing breast milk has been shown to have a detrimental effect on motor development. Caffeine intake should be kept to no more than 300 milligrams. WHO breastfeeding guideline for HIV-infected mothers. Replacement feeding is the process of feeding a child who is not receiving breast milk with diet that contains the entire nutrient found in the breast milk. If replacement feeding is acceptable, feasible, affordable, and safe, HIV-infected mothers are recommended to use replacement feeding. Otherwise, exclusive breastfeeding is recommended. At 6 months, if replacement feeding is still not available, HIV-infected mothers are encouraged to slowly introduce food while continuing breastfeeding. Those with HIV-infected infants are recommended to continue breastfeeding even after 6 months. Evidence has been reported that antiretroviral ARV interventions to either the HIV-infected mother or HIV-exposed infant can significantly reduce the risk of postnatal transmission of HIV through breastfeeding. Breastfeeding has many health benefits for both the mother and infant. Breast milk contains all the nutrients an infant needs in the first 6 months of life. Breastfeeding protects against diarrhea and common childhood illnesses such as pneumonia, and may also have longer-term health benefits for the mother and child, such as reducing the risk of overweight and obesity in childhood and adolescence. Benefits of breast milk. For the infant, immunity against infections, childhood diabetes, childhood obesity, allergic diseases, cognitive development in childhood, and higher intelligence later in life. For the mother, bonding, financial benefits, and natural postpartum infertility. Summary. Exclusive breastfeeding means that the infant receives only breast milk. No other liquids or solids are given, not even water, with the exemption of oral rehydration solution, or drops or syrups of vitamins, minerals, or medicines. Successful breastfeeding depends on early preparation during pregnancy, with teaching on the technique, position, benefits, and challenges of breastfeeding. When the baby sucks its mother's breast, a hormone called oxytocin compels the milk to flow from the alveoli through the ducts, milk canals, into the sacs, milk pods, behind the areola, and then into the baby's mouth. The amount of milk produced depends on how often the mother is nursing and/or pumping. The more the mother nurses her baby or pumps, the more milk is produced. Factors that affect exclusivity and duration of breastfeeding are insufficient milk supply, engorgement, blocked ducts, mastitis, sore nipples, societal barriers such as employment, inadequate breastfeeding knowledge, etc. Women who are breastfeeding need to be careful about what they eat and drink, since things can be passed to the baby through the breast milk. HIV-infected mothers are recommended to use replacement feeding. End of study session 8. Thanks for listening.